Hi, everybody. Welcome to your ER solution. An ER physician who's been working with Meditech for a decade or more, and I have learned a lot of things. So I wanted to share this. This is my approach to Meditech, and this is the old version of Meditech and used in most HCA hospitals. And the goal of this talk is to complete a complex chart in less than 2 minutes and a simple chart in less than 60 seconds. So let's dive in with a couple disclaimers. I'm doing this presentation educational only, geared toward providers. It's both for docs as well as APCs. The program itself belongs to Meditech. I have no invested interest in any of it, and this talk is not sanctioned by them. I'm doing this to help my providers because they come on first shift and they struggle. If you have experience with Meditech, I think this will still help you, but it is more geared towards people that haven't used it. Couple caveats: I don't like checkboxes. I never have. It's hard for me to get the cursor over there, and it's cumbersome and tedious. Some people are amazing at it, and that would not be me. I like simple charting, and the simplest chart for me used to be things like the T-sheets, but now it is a free text chart as much as possible. So I've converted this point and click chart to a free text chart as much as possible. So there's a lot in Meditech. So let's start at the beginning. And again, this talk is geared to be simple for your first shift. So there's trackers. When you first get in here, you'll see a screen like this, and it can be a little bit daunting, but what you want to do is there's two trackers you want to use. Three, if they will allow you to have three open, but that's facility dependent. But almost all of them will have at least two. So one tracker would be provider unassigned, and that's going to show you who has not been signed up by a provider in the department. And then you would open a second Meditech screen over here, go to trackers again, and then my patient, provider by length of stay. So what's going to happen is this first tracker will have the unassigned. I'll show you in just a second. You click on it, you hit document, never use sign up, you hit document, and that will take it off of the unassigned tracker and it'll move it over onto your my provider by length of stay, my patient provider by length of stay, and you can track it there. Now on that, my provider by length of stay, if you're a mid-level, it shows only your patients. If you're a physician, it shows your patients as a physician plus any patients that a mid-level may have assigned to you. So here's an unassigned tracker with a fictional patient. Again, no doctor here, no PA here. It is unassigned. So what you would do, click on this patient and you would click document. Again, do not use this one here unless you know what you're doing. That's a little bit more sophisticated. And honestly, this one is where you're going to do your timestamps, not this one. A lot of people think that timestamps. It does not. Go to document. So when you first go into Meditech and you hit document, you're going to get this big screen, a lot of information. Now Meditech's nice because it has these favorites that you can build. And then once you build them, that is what you will see when you hit this screen. You can always get to all, but favorites will show the common ones that you use. So there's only two charts that I use. I use the general peds and the general adult. Why do I use them? Because you'll get used to these backwards parentheses, and these are hard stops. These are things that have to be completed before a chart can be signed off. And I hate hard stops. I like to minimize those because those are obstacles in my way to signing off the chart. If you use a general template, then you will need to remember to add things in. Say, if you have a chest pain patient, add in the heart score. If you have a stroke, you have to add in the NIH stroke scale. But I find the things to add in is minimal. If I approach it this way and the charting is so much easier, I would rather remember that stuff or add it in another day as an addendum if the quality folks come after me, as opposed to go through these charts with all the hard stops. So first day, general, and it'll show general adult and general peds. I will highlight the general adult. I will hit add to favorites. Then I will highlight the general peds, add to favorites, and then when I go in next time, I will see general illness. This is for adult, and general illness peds is my options. So today I'm going to pick on, we're going to do a fictional patient with an adult with abdominal pain who, let's say, was running to the bathroom, tripped and fell, sprained his ankle, and it comes in for evaluation of that. So I would click general illness. I will hit OK. That brings me to this screen here. Now, you're going to notice some stuff. You see the asterisks here? These are not hard stops, but these are things that are time stamps. So these are things that are tracked. And the reason I bring this up is, let's say that you see a general, or you see somebody on the unassigned board and you go and see the patient without clicking on them first. Or you click on them, but you don't complete your documentation, or you don't timestamp your documentation, which is right here, the greet time. So let's say that you just go in and see them, and you go talk to them, and you come back out, you see them on the unassigned tracker, you click on them, you hit document, and you get to this screen. Well, you saw them 5 minutes ago. What you can do is click here, and you can adjust that down to 8:47, and that would be your greet time. After that, again, a lot of stuff on these screens. I'm going to tell you, ignore the majority of it. Come here where this little asterisk is, hit your complaint, and that is going to open up this little pop-up box. And what you're going to do is you're going to take this bar and you're going to drag it to the bottom. Once you get there, you're going to see this dotted line. This dotted line is a great area in Meditech, because what you can do is click on this box here and it'll bring up this area here where you can dictate or free text in a HPI. Now, in the past, the HPI used to be a lot of information, but now CMS wants it under the MDM, which I'll show you later. So right here would be relatively brief. You could put something like, this is a whatever-year-old gentleman who was running to the bathroom for his abdominal pain, tripped and fell and sprained his ankle. I'm old school, so I'd probably put ankle pain is aching, non-radiating, worse with weight bearing, or something like that. It's going to catch those three elements of the PQRST, which used to be required in the HPI, and it's just a habit for me at this point. So once you put in your text there, then you're going to hit OK, and there's your text, and you can go to the next section. Now, people will ask me, why don't I use this since it says free text HPI here? And the reason I use this area is because of that star right there. Remember, those stars, you want to make sure that you get those completed. This up here used to have it has a spell check with it, but now with dictation, there's a spell check included. So I just use here. And again, if you do one and you want to add in a second one, you can do that there. It doesn't make a lot of sense in this section to do that. But under the review of systems, you click here. Up at the top, there's two options. There's the systems reviewed. This is what I typically use, and I will click here and click this box. If you're unable to get a history such as review of systems, such as the patient was intubated or respiratory failure or they were code, whatever it may be, you can click here and put the reason, and maybe they're intoxicated, who knows. But I will click here and I will click that box, and then I have to complete two of these down here. Now, what you do is you go ahead and click for this one. Since they had abdominal pain, I would click here. And I would complete that. And since they had a sprained ankle, I would click here. In general, if it was just abdominal pain, I would do this and I would do the constitutional. I use the constitutional a lot. And when you click on that and open it up, it's got options like, do they have fatigue, chills, fever, that kind of stuff. It's relatively quick. As with any point and click, you can click at the top and it'll put clicks all the way down the list. And then you can unclick the ones that are not pertinent. So after you've done the review systems, come over to the past medical history. Now this is a tricky one because this section right here, review of nurses' notes, need to be completed, and they don't have a star or anything else to indicate that for you. But a lot of people miss this, especially when they're learning Meditech. But again, you want to make sure you're doing it. And again, we're just following this tracker straight across the top. So we did the HPI, review of systems, and now we're on to the third one. So as long as you're just following this across, you're going to hit these different things. You have to remember to do the review of nurses' notes. You click there, and it'll give you options. Generally, you're going to review and agree with them, and then you would hit OK. If the patient has been in Meditech before in the facility and there's a history there, this pop-up box will come up. You can click here. Like I said, when you click here, it'll put a checkbox on each one of these checks right here. So instead of individually clicking, you click one and boom, it's all there. You hit OK. Now you can see reviewed, available, and agree is there. Now we're on to physical exam. You get into physical exam. Here's a star right at the top. It says you're reviewing the vital signs. And again, you check that box. If I never go into this abnormal vital signs, if I'm going to free text something in there, I would click here and I would free text a note such as nurse didn't put in the vital signs or something if you want to do that. But generally, you know what's going on. If you've been in the room with the patient, you have seen their vital signs. Okay, next thing, ignore all this down here. We're not going to go there. We're going to go to the basic physical exam. We're going to click here. When you click there, it's going to bring up this general physical exam right here. I have clicked here, which put a check mark in all of those boxes all the way down. If there's things that I did not do, I would just simply unclick them. The one caveat here is the respiratory exam is limited. So once you click this, I will click this box. You can see your lovely data should line right here, which means you can free text. I will click here, come in here, and I will free text lung exam. Lungs cleared auscultation bilaterally. And then I would hit return and I would put abdomen is mildly tender diffusely without rebound guarding or peritoneal signs, something like that. Next, I hit return, then I put ankle on the right is mildly swollen with tenderness inferior and posterior to the lateral malleolus. There's no joint instability, something along those lines, however you want to do it. After I do that, I would obviously unclick the abdominal up here since I included that part in the exam that I free texted in. This area is also fantastic for painting a picture of rashes or mental status for the patient for psych. I love this area because it paints a very nice picture. Some people like this over here. Again, point and click, and I can tell you from a peer review, and quality, being on those committees for years, this is high risk over here because the chart's really hard to interpret with all those point and clicks, what's positive, what's negative. Whereas if you put it in your own words here, it's so much easier. So let's keep moving. And again, this is all a discussion, and you can look at that about what to do. So the next two tabs are not necessarily tabs that you're going to use on every patient. The INTD is for interpretation tab. I only use this tab when I'm talking to a consultant for admission. And the reason being is if I click on it and I have information back, it's all in one area and I don't have to click around to find information. And again, you would have your radiology here as well as your lab information, and then you can toggle quickly and talk to them about what you're seeing while you're looking real time at values. You do not need to do things like the lab statement or the imaging statement. You can do it if you want to. It doesn't add anything. I'm a simple guy. I'm not going to do it. So next is procedure. Of course, you're only going to do this if you do a procedure. You have a few different options. You can pick from the pre-built procedures that they have here. But again, this is point and click. I already told you I don't like that. So what I've done is taken procedures, and on my dictation, I've created commands. So let's say for this gentleman, I did a splint. What I would do is click here, and I would dictate into my voice splint disclaimer, and it recognizes that as a command, pops it in there, and then I go ahead and make whatever adjustments. If I have lacerations, I say laceration disclaimer, and I can do that 5 or 6 times if I have 5 or 6 lacerations, and I can just go through and modify and change. Another option I like to do is if I have, say, a hip dislocation that I reduced up here, I'll do the procedural sedation disclaimer, click here, I'll do the joint disclaimer, and there will be my procedures, boom, boom, done. So that's the procedure section. Next section is the MDM, medical decision making. This does not show up. This was added in, this sepsis thing here. And the MDM, this is since CMS has changed and wants a lot of information in there. After I do this part here, I will click here, time of reeval, and I will click now, which timestamps it. Timestamping is key, especially when you're involved with peer review or quality. And then I will hit the reeval status. And there is a box with a bunch of dashed lines. I can text in there. And what I will do is for my initial MDM, I will include all the summary of key elements that was, a lot of which I used to include in my HBI. I'll include here. And I do that for CMS and billing purposes. And so key things for the chief complaint, the review of systems, past medical history, et cetera, would go there. If this was just a simple thing like a medication refill, you can do that, or you can just click here and you can free text in. Patient is here for his Lisinopril refill, blood pressures, whatever, whatever, and this is what we're going to do. And then I have, of course, pre-built disclaimers, and mine is I have a high blood pressure disclaimer I could put in there for that patient, or I could put in a general discharge disclaimer, and I just say those commands in the voice dictation, and boom, there it pops in. Now, those disclaimers, I can see about making those available, uh, but the other option is generally people in the department have already built those. You can ask them to share. In my department, I've shared those with everybody. So they can either use what I've pre-built and kept in there, or they can take it, copy, paste, and adjust it as a command. But that's available throughout dictations within groups, and it's nice. So let's say that I have my abdominal pain. My free text would be something along the lines I would reeval, timestamp, and status. I would put in my free text, which would be along the lines of this elderly gentleman run to the bathroom, trip, fell, hurt his ankle, aching, non radiating ankle pain, worse with weight bearing period, also complains of abdominal pain. It's a non-radiating aching abdominal pain, which he states he's had in the past with diverticulitis, and he believes this is diverticulitis again. Uh, the plan is to get an x-ray and blood work urine. I discuss that with the patient. He consents to doing the x-ray of the ankle, but states he's positive that it is diverticulitis and does not want imaging or blood work, but would like to be treated, period. He says that he has received augmentin in the past and it's worked well for him, period. We'll treat the patient in this manner. Then after I get my x-ray back, I would come down here, click reeval time to timestamp it, and I would put in there X-ray image obtained and reviewed. There's no fracture, splint applied, and crutches. Patient is going to follow up with orthopedics. Now, typically, I would have a couple disclaimers up here. One would be a sprain disclaimer discussing that, even though we don't see a fracture, it could be there, and ligamentous damage cannot be ruled out by radiography. And then I would have a discussion about the abdominal pain, and I would have a discussion also that I recommended tests X, Y, and Z, and he only wanted the X-ray of the ankle. Again, the sepsis thing would not be here unless this was a sepsis patient, and that's something that you can add in, which I will show in another talk. So we've done our patient with abdominal pain and ankle pain, and we are on to depart. Again, we've just tracked along here. Depart, you come in here, you hit add impression. Once you hit add impression, it is a search bar here, and you can type in diverticulitis if you would like to do that. I am a fan of general descriptions as opposed to nailing myself into a corner with a specific diagnosis that I didn't confirm by CT. So I would do something like abdominal pain. That'll bring that up, and I can click there. Now you can CMS like specific, so you could do general abdominal pain, or you could do RLQ abdominal pain. You don't have to put the whole word. You can put fractions of words with spaces in it, and it'll search and find it for you. This is going to put this as your primary diagnosis, and then you can stay on the same screen and you can type in ankle sprain and it'll show that. You can select that and it'll make it your secondary diagnosis. After you pick your diagnosis, you click OK. Boom, it drops it on your chart. You come down here, and I'm going to run through the dispositions. Obviously, this is going to be a discharge, but I'm going to show you the different options. So, discharge, pop-up box, 3 items were highlighted on the discharge to. Here's discharge to home. I would click here, OK, next, and then it'll show a time. And you can either put the time in or you can click now. Since it's real time, I click now. I hit OK next, and then there's date, and I hit today, and boom, it's in there. I also like to come down here and click the discharge note, which is just a general discharge note about follow-up, etc. in there, and to call 911 if they have any problems. If you have, this is the discharge again, and again, you will notice the reverse parentheses. These are hard stops, so they have to be completed. If it's an admission, again, reverse parentheses, you got to do all 3 of those. You'll see other stuff here, like when you called them and who the doc was. I don't put any of that in there. That's the doc who I called, and the plan is in the MDM, so why repeat it here? I do these things, so admit, accept, yes, time, now, date, today. Boom, you're done with that one. On to the next one, transfer, hard stops, request time, and date. Boom, you're done. Any other discussion goes in the other section. So let's just do a quick chart right now, and it's going to be the same one we've talked about, but I will show you in 60 seconds or less, I hope, what I would do. So let's go to it. So I click, I've chosen the patient from the general, from the unassigned, general illness. Okay, boom. Click here, pull the bar down, click here, and put my HPI in there. Gentleman tripped going to the bathroom and hurt his ankle. And then I go to review systems. Review systems, click here for that all negative except as commented. And then I come down here for his abdominal pain and his musculoskeletal. I click and I drop the tab and it pre-checks, and then I uncheck whatever I don't need. Boom, done with that. On to past medical history. Here with the nurse's notes, don't forget that. Click that one. If they have this information, I click and drop that in there. I can modify if needed. On to physical exam. Boom. Click here. I review the nurse's notes. I'm on to the general physical exam. It's here. I free text in my finding of abdominal pain, the lung exam, the ankle exam, whatever's appropriate, and unclick what you didn't do and put in here, derm or whatever else you want to put in there. When you're done with that, you're on to the procedure section. Procedure section for if you put a splint or anything, and then you are on to your MDM. My initial comment would go right here, date, would be my time right here, and the free text bar where I would put in information summarizing for CMS. And then when I see him later, I would go in here and I would put information regarding what's going on. And since he just wanted a general x-ray, that's all it would be. And I would put those disclaimers here, or I could free text them here. On to depart, abdominal pain, sprained ankle, and then I have my discharge, my three caveats, or my three requirements there, boom, 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 and I'm done. That's it. Anyway, so I will have more information on other talks to go through, but this is a quick overview of how to do Meditech day one in your emergency department so you can survive and thrive. This is your ER solution. I hope this was useful.